I've had knee problems since I was 17 years old from a basketball injury in high school. I had to have a scope done because there were no MRIs at the time to tell me how much damage, and it came back that I had totally tore my ACL.
I aligned with some surgeons from both coasts, from Seattle and New York, and I was an early adopter of a Swift Path rapid recovery program that enabled us to take a younger patient, do a total knee replacement, and get them home within 2 or 3 hours.
Up until recently, when my pain became worse, Dr. Meade suggested the total knee replacement, and I was ready. The only problem was we had difficulty trying to schedule it because my husband, who's a pilot, is often away, and I had nobody to help me at home, so we couldn't coordinate the two schedules. And then he said, well, how about we try outpatient knee surgery?
This is not a new concept. It all has evolved into the outpatient arena. What's new is I've been performing outpatient unicompartment arthroplasties or partial outpatient knee replacements. We have now been able to convert that into total knee replacements as an outpatient, and we've been doing those for the last 8 months.
My concerns with the surgery weren't for health issues or for pain. My concerns were that I wouldn't be able to take care of my family and I'd be laid up for a few weeks, and that's not an option with my lifestyle because my husband travels.
So the advantage is we've instituted the whole rapid recovery program for everybody across the board. So there's no difference at all in any part of the protocol, except if you qualify and you're motivated and you're healthy, you can go home that day.
Out of all the procedures I've had, this is the most complicated procedure I've had, and it's been the easiest rehab.
The patient actually has to pass our preoperative physical therapy program if they're going to be an outpatient total knee replacement. They have to go to physical therapy, they have to understand all the physical demands and all the activities that they will be required post-operatively.
He took me back to the operating room at 6:30, and at 10:30, exactly 4 hours after, I was up being discharged and walking with a walker. That night, my son was in a championship basketball game. I was able to go and attend that game that night with no walker or assistant devices whatsoever.
Every patient that's on the Rapid Recovery Swift Path home program has to pass discharge criteria before they go home.
6 weeks post-op, we did take a trip to Florida, and I probably walked in excess of 21 miles that week, and I was able to handle it at the 6-week mark with no problem.
I'm extremely excited and proud to be able to offer this to patients. We've been working on this for many years. It is integrated, it's physician controlled, it's physician directed, and every step of the program has to be coordinated. Everybody has to be on the same page. They all have to speak the same language. So at present, outpatient total knee arthroplasty is only being performed at coordinated health hospitals in the region.
Now that I've had the procedure, I'm able to keep up with my kids and my pain level is down. I would recommend it totally.